Hi, everybody. Welcome to the Arizona Oral Health Coalition's Bite-Sized Webinar Series. My name is Brianna, and I am the coordinator for the Arizona Oral Health Coalition.
Hello, everyone. My name is Tara. I'm the chair of the AZOHC Public Awareness Committee. I'm happy to be here today to present this bite-sized webinar. So our bite-sized webinar series consists of short webinars featuring the outstanding work of coalition members and individuals who work towards oral health equity. This October, we're hosting a special series of bite-sized webinars focusing on dental hygiene and medical integration. And today, in the third and final webinar of this series, we welcome Katharine Martinez. She is an oral health educator at Phoenix Children's Hospital. So welcome, Katharine. Thank you so much for joining us today.
Hi, everyone. Hey, thank you so much for having me. I'm so excited to be here. Happy Friday, everyone who's streaming live or who's watching it. Hopefully this is informative, and if you guys have any questions, always feel free to reach out or to drop a comment below and I can answer those.
Awesome. Yes, I'm certainly glad it's Friday too. So let's get this webinar started by first, Katharine, would you be able to tell us a little bit about yourself and your background?
Yeah, perfect. So I am a 10-year veteran hygienist. I have worked in pediatric general dentistry settings. With my Bachelor of Science in Dental Hygiene, I graduated from the University of New Mexico. And then I pursued my Master's of Public Health degree from New Mexico State University back in 2014. So I have been practicing with my MPH. And I currently, right now, am employed at Phoenix Children's Hospital as an oral health educator.
So Katharine, what does an oral health educator do, especially in the hospital setting?
So an oral health educator is a pretty brand new role across the nation. We've seen some hygienists coming into the hospital to do actual clinical brushing, but what this role is super unique, and Delta Dental of Arizona was the ones who kind of came up with this idea of how can we implement a dental hygienist in a hospital setting, and approached our foundation here at Phoenix Children's Hospital, and it was about a 2-year back and forth discussion as to what could a hygienist do? How could we implement a hygienist in the hospital setting? So what they ended up coming up with was hiring a dental hygienist, which happens to be me, luckily me, and going into the hospital and overseeing kind of all of the products that are oral health related coming into the hospital, making sure that we're revamping them to make sure that it's pediatric appropriate. I also am doing a lot of work with the NICU, which is a neonatal intensive care unit, the PICU, which is a pediatric intensive care unit, and the CVICU, which is a cardiovascular intensive care unit, as well as the hematology, oncology, bone marrow transplant unit. So I oversee kind of all of those units, making sure their policies and procedures as they're doing oral health and how we can reduce hospital-acquired infections across the entire organization. And I sit on numerous committees to doing that.
Wow, that sounds so amazing, Katharine, and just so innovative to have a hygienist there at the hospital. What led you to this role?
Yeah, so my background with working with pediatrics and working in the general dentistry setting, I realized working in that clinical setting, I was destined to do more. I was kind of bored out of my mind, and I'm like, I want to help more people. I want to do something greater. So that's when I pursued my master's degree. And I started kind of researching what I could do with my hygiene degree and my MPH. Trying to get my foot in the door with public health is really difficult, especially if you don't know some people. Just trying to work your way in the door, it's really difficult. And also, trying to figure out where my passion was, what I wanted to do. So I decided to start volunteering and did a lot of volunteer with Clackamas County Public Health Department in Oregon, leading dental access for pediatric patients to get emergency dental care. So I kind of piloted that program over there, and that was all volunteer work. Going and volunteering with Presbyterian Hospital in New Mexico as an oral health consultant for the oncology department. I worked with the nurse navigators, especially the head, neck, and lung. We kind of coordinated together to providing those patients who are going through head and neck cancers with proper oral care, pamphlets, education, resources, anything that they needed. So it was in a consultant manner. And I realized when I did that position there, kind of like a light bulb went off, like there is so much work to be done in this area. This is where I see my passion. This is where I want to be. So I set out trying to find a position that I could do and get paid for it at the same time, and came across this amazing opportunity that Delta Dental and PPH had put together. And I, saw what was required, and I checked all the boxes, and, with my volunteer experience and everything, and I said, let me just go for it. Let me try it out. Let me see it. And it worked out. So that's where I am right now.
Wow, that's really awesome. That's a really impressive and unique career path. So this role at Phoenix Children's that you have, it definitely sounds a lot different from the traditional clinical hygiene, like you were saying. And do you find that the patients you interact with have different oral health needs as opposed to maybe in traditional practice?
Definitely. Yeah. So, we definitely see what we see in traditional dental practice, abscesses, dental decay. What we see coming through our EDs, especially our emergency department, is sometimes just an abscess that, is causing significant pain, swelling, cellulitis of the face because it hasn't been taken care of. So we see that coming into the emergency department quite frequently. We see some of our patients that are inpatient having the same kind of dental needs. But what we really see is, for the oral health needs, is our patients that are undergoing, those who are extremely immune compromised or who are going through cancer therapy or a blood disorder like sickle cell, or if they're in intensive care on a ventilator or trach. We see the oral health needs exacerbated, like dry mouth with the xerostomia. We also see mouth sores and mucositis sores. We see so many different oral conditions that you wouldn't normally see in a general practice. So finding different ways of approaching that patient and finding different products, oral products that we can use that really benefits them to put them at the best state of health, which actually improves their treatment outcomes and decreases hospital-acquired infections.
Oh, yeah, I can definitely see how having a hygienist in the hospital, particularly for those kinds of patients, is so necessary. And Katharine, is this your role? Have you seen that this is a common role that hospitals have, or is this pretty unique to Phoenix Children's?
It's pretty unique to Phoenix Children's Hospital. I know you guys have spoken to Michelle and Lori at Dignity Health, and they're kind of doing something in the intensive care units with hygienists coming through in kind of a rotational capacity and doing oral care on the ventilated patients. Whereas this role, I'm not really doing anything clinically based, it's just education. And across the nation, I talked to a few children's hospitals. I'm on the committee for the Solutions for Patient Safety, which includes about 150 children's hospitals all across the United States, and presenting my role to those hospitals. And they've never heard of something like that. And they all go, at first, they go, oh, well, you're an oral health educator, so what do? Are you just brushing the patient's teeth? And I said, oh, no. There's a lot more that goes into it. And I kind of explain the process. And then afterwards, they're like, oh my gosh, this is such a huge need that we never knew we had. And how do we get somebody like you into all of our hospitals? And I know Texas Children's Hospital is really interested, and there's Ann Lurie Children's Hospital in Illinois that's really interested in kind of doing a pilot program to kind of get this up and going. And I know they talked to Delta Dental to see how can they get the funding to get somebody like me in their hospitals as well.
Wonderful. Yeah, that sounds like such an opportunity, and for the future of these types of programs. And maybe we can touch a little bit later about how maybe coalition members might get involved in that work. But I was also wondering, what challenges in getting these patients the proper dental care do you often come across? You'll identify that they maybe have this need, and you're able to give them that education. If they need more follow-up dental care, what challenges do you have, or have you seen in that?
Yeah, so one of the biggest challenges that we see in the hospital setting, well, for starters, is when they are on access on Medicaid. A lot of them don't even realize that there's dental benefits associated with that Medicaid coverage. So having that understanding and maybe from the managed care organizations to say, oh, here's where your dental home's going to be, to make sure that they're already set up with the dental home. So that way, before they come into the hospital setting, if they have any intensive care needs or any emergent needs, they're already getting that taken care of. So that's where I think a huge gap lies right now, is a lot of our patients who already have that Medicaid dental coverage are not being seen. So that's a huge issue. And we also have the issues with the patients being inpatient for quite a while. Some of our bone marrow transplant patients are in for at least 32 days to 2 months to 5 months. It varies how long they're inpatient, and dental needs come up, and we do not have any dental providers in our hospital. We have a list of maybe about 32 providers for if there's an emergent dental need, and when you go down the list, it is so hard to get one of those providers to come in because they're seeing their own patients in their own clinic, or they don't have the capability of bringing in their supplies into the hospital because we don't have all of the supplies to accommodate them. So we're really lacking on having that dental provider in the hospital to help with those emergent needs.
Yeah, I imagine it must be, of course, a challenge to provide dental care to a patient who is medically frail, but it's, of course, so necessary, since you mentioned earlier that it is definitely connected, correct, the oral health with the overall health and the outcomes of these patients?
Definitely. Yeah, what we see is, if they have poor oral health coming into the hospital, it sets them up for long-term issues, especially we have in our cardiology department, and everyone knows there's a huge link between oral health with endocarditis. So those medically fragile children who are having open heart surgery and have poor oral health, they show poor treatment outcomes, so they end up likely not really surviving or developing a hospital-acquired infection, which sets them up for pneumonia or sets them up for a central line bloodstream infection.
Absolutely. And Katharine, I'm wondering, I can imagine you have so many stories with this role being so new, and you kind of being a pioneer in this field, I guess, not necessarily the field, but the position and the location being in the hospital and working with these types of patients. I can imagine you have many stories, but maybe you'd like to share with us a patient or a story that you have that really kind of illustrates the importance of your work, and maybe something that you've held on to and has been meaningful to you.
Yeah, no, I mean, every single day that I come into the hospital, it's like a life-changing experience, which I don't think a lot of people can say every time they go into work, but when I go into the hospital and you go into a patient's room, when you're opening that door, you don't know what you're going to find. You don't know if that patient's going to be, happy up and playing. You don't know if they're going to be extremely sick and in bed and crying and in so much pain. You don't know what you're walking into. So every single day, you kind of have to mentally prepare yourself. Like, you don't know what you're going to see. You just need to go in there and do the best you can. And, at first I thought, well, I'm just a dental hygienist. Like, what can I do that would make that big of a difference or an impact? And, one patient that comes to mind is we had a patient who, when I walked in the room, the providers were like, we've done everything for him. We don't know what else to do. He has severe mouth sores all through his mouth. He can't even swallow his saliva. He is just struggling in so much pain. He's hooked up to a pain pump. Is there anything that you can do? And so I was kind of fairly new on the unit, so maybe about 2 months in, and I went into that patient's room, and I'm like, oh my gosh, this is the worst case of mucositis I've seen to date. So I looked at the mom, and the mom just gave me that look, and she's just like, I don't know what else to do for him, and that's the heartbreaking thing, having children myself and just being able to not help your child is like devastating. So I went in there and, we looked at what his oral products were, and they were not sufficient. So I helped mom figure out what we should do for the products that would help him the best, because they were using a Sprite Zero as an oral rinse for his mucositis sores, which was burning and aggravating, and I don't know why on earth you would use a soda as an oral rinse, but needless to say, we got him the correct products, we got him the correct oral rinses, we got him the correct mouth moisturizers, got him the correct products that we could use in his mouth, and cleaned out his entire mouth. And I went to turn away, and he grabbed my arm, and he was not able to talk really, and he just whispered, "Thank you, I can finally swallow." And I was like, oh my God, like I need a minute. So I walked outside and I'm like, just wiping the tears away. And I'm like, that right there is just like makes the entire everything worth it, right? My heart is like so full. And I'm like, yes, I'm a hygienist. And yes, I, do oral care, but you can make a huge difference and an impact in somebody's life. And that mom was forever grateful.
Oh my gosh, I'm getting emotional just listening
know.
to that.
I know. I'm like thinking about it. I'm like, oh God, stop.
Oh wow. Well, that's definitely an incredible story, and what a really perfect example too, because it just shows, that there's these knowledge gaps that, we might think, oh, of course we wouldn't use soda, but with your role providing that information, it's so impactful for families. And what happened? Do you know if that patient recovered, or did his mouth sores get
Yes.
better?
So surprisingly, those mucositis sores, usually when you see a cancer patient, when their ANC, when their blood cell count kind of completely bottoms out, when they start recovering those, they start to heal up. So he actually made a full recovery. They stayed a little while longer than we expected. Usually it's about, 2 weeks at the most. He was about 3 or 4 weeks with those mouth sores, but he ended up recovering from those just fine. And the second time around, he had to get chemotherapy. He did not have those mouth sores again. So we were able to keep his mouth in a great state of health. So he didn't get those mouth sores again. And I just saw him a couple months ago and went down to the clinic and saw him, and he's happy. He's in school. He is traveling, and it just makes my heart so happy.
Oh, that is so wonderful. What an inspirational story. I love that.
Awesome. Well, yes, thank you so much for sharing that story. I'm going to be thinking about that for a while.
I know. Anytime, if anybody else wants any other stories or wants a good cry, I got a lot. So
Oh.
We could talk for days on it.
Well, we're going to definitely have to talk about that in the future. Speaking of future, good transition. What do you see as the future of this program?
Yeah, so the future of this program is, looking great. Everyone in the hospital has seen what this role can do. We've seen what it benefits for the providers, it benefits the patients, it benefits everyone. And so the next steps that we're trying to do is we're trying to get a dental department going here, because there is that high need for patients to get that emergent care taken care of. And if they're not able to go outpatient, we need somebody inpatient. So our next steps is to get that going. Hopefully, once we get a dental department or oral health department, we don't know what we're going to call it yet, getting a dental residency program in here as well. So that way we can have our pediatric dental resident students coming through and providing that care as well, and getting that experience, that hands-on experience with the pediatric patients, because they are so different than the adult hospital patients. And then some of these children are so medically fragile that to have that hands-on experience with them will set them up for success in the future.
Absolutely. Sorry about that. I was on mute. You'd think I would know better by now, but it's so exciting, and I would love to see this work expanded. And I know that our coalition members, are passionate about medical and dental integration, and this is just such a great opportunity. What can coalition members do to support this program or to support its expansion? Or I know you mentioned things like there's not enough providers or dentists that can come into the office to provide care, or the hospital to provide care. Maybe from an advocacy standpoint, or just what do you think coalition members might be able to do to kind of push this in the right direction, or support that they might be able to provide if someone is hearing this and they're like, I really love this idea, what can I do to help?
Well, yeah, I think, if obviously funding is a huge, thing that we would obviously need to start the dental department. I know we're going to reach out to our foundation here at Phoenix Children's Hospital, and hopefully they can come up with some funding. But if anybody has any ideas as to grants that are willing to fund kind of an entire project or portions of the project or anything like that, we would definitely be willing to kind of take a look at that and hopefully see if that would work with what our goals are for the hospital. We also really need, if anybody knows any pediatric dental providers who wants to come into the hospital setting, if they can do a shout out to them or kind of talk to them about getting privileges at PCH, because I know it takes kind of a month or 2 month process of a background check and everything to get privileges here at PCH, but that way that they're able to kind of expand our list in the interim before we kind of get that dental department going. So that way we're making sure that our pediatric patients' needs are met, because right now it's a struggle and it takes away so much time from the providers trying to find these dentists to come in when they could be providing the care for the patient. So why are we wasting so much time going down a list and getting no, when they could be, better taking care of that patient? So if anybody knows of any pediatric dentists that accept access, because a lot of our patients here, about 75% of our patients that come through are on access. So, and I know a lot of pediatric dentists do take access. So if they're able to get privileges here and then start the setting up the process, and then I can help kind of coordinate and work with them as to how they can come through and kind of help out.
Yes, and also, Katharine, you are in the coalition. You do serve as a kind of in a leadership capacity for the Committee for Medical and Dental Integration. Is that correct?
Yes, that's correct. I took over that role. I'm hoping I'm doing a good job. I told them, I was like, you know what, I might not be the best at it, but I will try my hardest. And, so far we've gained our group. We've got a lot of different new members on our group. And we have some exciting new developments that have been coming through. So we're super excited that Dignity is willing to give us a scholarship of $1,500 to start what we are hoping will be a huge expansion of the social determinants of health. So we're really wanting to have dental providers kind of gain awareness of the social determinants of health screening and using it in their practice. And then hopefully we can kind of correlate it with a new Arizona 201 open loop referral system so that we can coordinate the patient to get the correct care that they need all in this closed loop referral system. So there's exciting developments to come. So everyone's just stay tuned, because we are on the move. We are ready to break some ground here.
For all of those listening who may not be part of a committee or maybe not even part of the coalition yet, if you want to do some more work with Katharine, learn more about the incredible work that she's doing, just email the coalition at azohcoalition@gmail.com and we can get you hooked up to a committee and you can work directly with what we've got going on.
Yeah, and you don't even need to be a dental provider. You don't need to have any dental background. Anybody who wants to just get out there and start helping, and we have tasks and roles for everyone, and we love everyone's input. They just bring so much to the table.
Awesome. Well, that's definitely a lot of exciting developments. We'll be following all this news and we'll definitely be sharing it along with anything else going on. So
yeah,
awesome.
Super excited.
Perfect. Well, thank you so much, Katharine, for talking about all of this awesome work going on at Phoenix Children's Hospital. I am just blown away by the work that you do. It is really impressive, and I hope to see where this program leads. Hopefully it leads to some more developments in the integration field. But I'm looking on Facebook and, oh, sorry, go ahead.
Oh, no, I was just going to agreeing with you. It's going to have a huge, expansion benefits, and hopefully this here in Arizona, piloting the way, is going to change for the whole nation. So we'll see. There's exciting developments there.
I think
we're
we're
on
ready.
The forefront of something good. That's good to hear.
Right. But thank you guys. And then if anybody needs to reach out to me, I didn't put my email on this slide, so I'll just I can put it in the chat below, but I can also just give it to you guys. It's K Martinez, and my last name's on there. And then it's just the number 3 at phoenixchildrens.com. And any input, comments, questions, anything that I can help assist you guys or do anything for you guys, always feel free to reach out to me. I am available. It might take me a day or two, but I will get back to you, I promise. But no, I mean, this has been awesome. I appreciate you guys so much and everything you guys are doing. And these webinar series are so cool. It kind of gives you just like a little snippet of education and kind of into the life of these coalition members. So thank you guys for doing that.
Thank you so much for being with us, Katharine.
Yeah, thank you guys.
Well, we will see everybody on our